So today's event has been the official launch of the ATTC network, the second phase of our funding. And as director of Manchester-based ATTC, then I thought it was really important to be here to interact and network with people and actually hear some really interesting discussions and talks today. So I think the new phase of the ATTC network is really important to help us focus on how we can really establish increased numbers of clinical trials in the UK and to bring these complex therapies to patients as early as possible and to then use our understanding and learning from the clinical trials to take that forward into the later phase trials and ultimately making these complex therapies available for patients as standard of care. So I think in order for the ATTC network to accelerate clinical trials in the UK, we have to look at the whole patient journey for clinical trials, and that's thinking about how we can recruit patients to clinical trials or offer them the option of partaking in a clinical trial, so ensuring that there's access for patients, equity of access, and then in terms of the actual clinical trials themselves, making sure that we can set them up rapidly, that we can recruit quickly to those trials and run those efficiently and have really good data and outcomes from the trials so that we can then get the information that we need to be able to look to the future for those therapies in order for them to be part of our standard of care for patients.